Good day. This is Barbara Brandt, Director of the National Center for Interprofessional Practice and Education at the University of Minnesota. Today, we have scheduled a webinar called Prevailing in IPE During a Pandemic. And it will be presented by the interprofessional team at Creighton University's Center for Interprofessional Practice, Education, and Research. What I want to say, and I'm going to talk a little bit how this came about, is perhaps the title that the Creighton group selected, Prevailing in IPE During a Pandemic, is the theme for the series of, I would say, informal webinars and podcasts and things we're preparing, because we're here to support you to prevail in IPE during this time. Next. So I'm here to welcome you. I'm Barbara Brandt, as I said, and want to introduce Gail Jensen. Whether she can be available to be on this webinar, I do not know, but she is the current chair of the American Interprofessional Health Collaborative, which is the membership organization affiliated with the National Center. Gail is a senior leader, happens to be from Creighton University, so she has been very busy experiencing the dramatic and very sudden changes in higher education today. So we're very grateful, and I'm personally grateful to Gail and others who stepped up to the plate to help us offer these webinar series to support those who are working in the trenches in IPE, leaders and in the trenches. The other thing, I'm just delighted at the response that we received to this first webinar. And from the list, there's many good friends who are participating. Next. So we've put this together because we were starting to receive quite a few inquiries into the National Center. And so we're going to be rolling out a series of web-based discussions, webinars, and forums to foster conversation learning and resource sharing among IPE leaders. And today's session will be recorded, and like all of our webinars, they are uploaded and archived at nexusipe.org, and we will be sending out the links to you so you can follow them. So I'm going to turn this session over to today's presenters from Creighton University, Joy Dahl and Katie Packard. Katie is a PharmD, pharmacist, board-certified cardiac pharmacist who provides both inpatient and outpatient clinical services. And she's also directs a clinic, which is Clinic with the Heart, a free interprofessional urgent care clinic. And I'll let them weave in their relevant experience into their presentation. Joy Dahl is the inaugural executive director of Creighton University's Center for Interprofessional Practice, Education, and Research. And she is responsible for helping lead initiatives promote IPE and collaborative practice for both Creighton University and CHI Health. So today they're going to share their experience on bringing up, and very suddenly, some of the anticipations of such an event that we're experiencing now, but talk about putting IPE online. So I'm going to turn it over to Joy and Katie.
Great, thank you, Barbara. This is Joy Dahl. I want to first thank the whole National Center team for this opportunity, and hopefully today we're starting a conversation about how we can all band together and support interprofessional education and collaborative practice at this time. I do want to be transparent, like many of you. My whole family is at my house and I am sequestered in an area, but I do apologize if you hear any children in the background. So our objectives for today are really to talk about the opportunities and challenges of changing times on interprofessional education. And we're going to share a little bit of our high-level story of how we banded together and addressed the pandemic as things happened rapidly. And then the follow-up webinar that my colleagues are going to give will go into more nitty-gritty about how to deliver IPE and do that successfully. We're going to do some reflection on strategies for success during times of change, and then what can you think about in your own curriculum and structure that can promote more flexibility, so when times like these occur, it induces not as much stress on the team. And we were lucky we had a pretty good plan and have transitioned pretty well in this. So we just want to share our story and hope to dialogue with you about that. Next slide, please. So from our perspective, we need the skills of interprofessional collaboration more than ever before for healthcare delivery. We've had clinical sites contact us and say how we're doing rounds on Zoom. We've been asked for some advice on how to do some of these things with telehealth. I've received many requests this past week about how to help our primary care team move to telehealth interprofessionally because they feel it's pretty siloed. Things like that as things are changing really rapidly. Support of our clinicians. Obviously, there's so much stress and the constant change. I have a good friend who's a clinician, and she said every day the process of getting screened as she goes in to provide care is different, and how stressful it is showing up to work and not knowing what's going to happen. Addressing resource shortages. How do we band together to collaborate and be effective when we don't have resources to treat those both in education and in practice? And then preparation for a different future. We will see transformation from this event. And how do we make and develop not only an education, but a delivery system that will help support our learners to be ready to prepare for a future that might involve more experiences like this. Next slide, please. So we wanted to provide a little bit about who we are first, just to give you some context about our curriculum, and then we'll talk more about our experience. So our vision as a center is to really cultivate leaders who are ready for change and go out and challenge the status quo. And our mission is really focused on education, research, and the collaborative care piece. Next slide, please. And we currently support 9 professions in our IP curriculum, so it's incredibly diverse in our learners, and some of these professions have multiple different degree programs within them. And we have about 3,500 learners in our IP Passport program. So all of our students do an online self-paced competency-based preparatory course called IP 500, Introduction to Collaborative Care. And then they're followed by doing 3 interprofessional activities. That's the minimum. They can do more. We have many students that go above that. And we'll share the variety of activities that we offer in our Passport. Next slide, please. And we have a diverse team, and I wanted to emphasize this point because I am always amazed when you bring different perspectives together, how that helps you solve complex problems. And diversifying your IPE team is incredibly important. So we have obviously representatives from all the health professions. These people are involved in the different programs, and different programs have different innovation and delivery models. And this has really helped us band together to look at what the best practices are, and having these multiple perspectives from people that are staff level all the way up to higher administration has been incredibly helpful to help us brainstorm and solve problems. We are already planning and audited our events for summer and are coming up with creative contingency plans to offer events in new and different ways. So we continue to innovate. And I would say the first step is to make sure you have that diverse team with you. Next slide, please. We also have spent a lot of time as a team thinking about our values. And I mentioned this because I think in times of challenge, it's really easy to get down and not feel grateful and feel overwhelmed. And the first thing we really, I think, focused on was, what are our values, and how in this time of change are we going to continue to have fun, assume positive intent, listen to one another, adapt, and really going back to this as a team has been important to keep us focused and make sure that we're still keeping interprofessional education and collaborative practice an important priority for our organization. And one of the ways we've done that is being adaptable and supporting it and not burdening our organization with needing to stress about IP. We mobilize to support the organization. Next slide, please. So a little bit about our curriculum foundations, and this is important too. One of the things that what we want to emphasize today is we put a lot of thought, which has helped us modify and be able to say, well, yes, we've changed our little bit of our IP delivery, but we're still meeting our definitions through the World Health Organization. We're still following our rigorous Passport program where activities are vetted and approved. We're still aligning with the core competencies, and that we may just need to look at a different delivery model. And how do we start to think about that? So we also turn to the HPAC document and have you follow those definitions. And so we spent time defining these definitions as a team, which helped us. This is what we went back to and looked at. Okay, so what does an online learning activity look like? And do we have any of those? And how do we adjust in this changing time? Next slide, please. And then we have activities that fit into 6 pedagogical categories. So we've also taken time to define them. And this was also, we wanted to bring this forward because this was also helpful when us thinking about what activities need to be postponed or can continue. So for example, our organization decided that most students need to be pulled from clinical sites. So that told us we needed to make sure we weren't focusing our energy on those, but looking at which activities might be possible to move to an online collaborative environment. Next slide, please. It goes into a little bit more detail about what each of these means. So we've defined these as a curriculum. And so this helped us as we went back and looked at our categories of our activities, which ones make sense and can be done well and robustly in an online collaborative environment. Next slide, please. So I'm going to turn it off to Katie Packard now, who's going to talk about how we've planned ahead and how we've adapted. And then I'll come back to close and we'll do questions at the end.
Thank you, Joy. So knowing that life happens and there are always students and faculty that have emergencies, we had planned ahead last year and planned for a very small Zoom-based or online-based synchronous case-based activity that was just planned for a very small group of students that needed an activity to either graduate or start rotation. So we have some flexibility in our passport in that these students need to complete 3 IPE passport activities generally before they graduate, but some professions have chosen to make it required before they start rotations. It's just a very simple concussion case that we wrote. And the title of the activity is called IPE Collaborators, Who Are We? And we've been the funny thing is we called it the last ditch effort case, and we keep referring it to this backup, this last ditch. And we've been trying really hard this last month to refer to it by its appropriate title since we're actually having to use it. But, you know, with COVID, we had to modify the activity. The activity required students to meet with a healthcare provider of a different discipline than their own, someone in their community, because Creighton has a lot of distance students. Over 50% of our students are remote learning or learning in their own home community. They're not on campus. And so knowing our colleagues, especially in the COVID hotspots, are very overwhelmed right now, we removed that requirement. And we decided to reformat the activity to accommodate a larger group of students by assigning them to smaller interprofessional teams with a moderator in a Zoom case discussion room. And it's a 1-hour activity over, 12 noon Central Time, where we're located in Omaha. But after 30 minutes of working up the case, the students then are going to move into a larger Zoom room to observe an interprofessional faculty panel discuss the case. Students will engage with the faculty and then they'll write a reflection activity afterwards. So, we learned that the unexpected occurs, and this backup activity has a lot of flexibility. It can be done with a very small group, or we're expanding it to recruiting more moderators to work with a larger group, and it can be offered at the last minute and meet a need. And all we plan on doing is changing the case every semester, so we can offer this activity as a backup up to 3 different times of year, so spring, fall, and summer. So this will be the first time we've actually needed to use it and to implement it, but it became a real big part of our COVID response planning. Next slide, please. So this just illustrates a timeline of the events, and it's really just meant to share that we had to work fast and mobilize with all hands on deck approach to mitigate the canceling of these events. So on March 9th, the university decided to contact one of our major IPE community events by the university president. This was our Project Homeless Connect event, and generally up to 150 to 200 students from campus are assigned or have signed up for this event, which would really impact those students that if it was their 3rd required activity. On March 11th, the announcement of the event being canceled was distributed. And on March 12th, we started to work with our CYPER team to cancel most of our interprofessional education events that were either clinical or community-based and funnel them to appropriate substitute events. Next slide, please. So some more specifics, or to look at that a little more granularly. So the first thing we did was set up a meeting to have a focus team to meet to discuss the crisis at hand. And we polled all of our activities to discern which had to cancel and which had to continue. And as Joy mentioned, having them categorized by the type they were, because we have over 100 activities. We were able to sort in our database quickly to determine which ones needed to be canceled and which ones could continue if they were all online to begin with. And then we needed to analyze the students. In order to work smarter, we decided to only look at students that needed the activity by this May, by this graduation date, in order to either graduate or to start their clinical rotations this summer. So we ran reports to determine the needs of the students, and then just determine which ones were urgent needs that needed to be addressed right away and which ones could wait till summer or next year. And then we proposed a contingency plan for students that were in need, because unfortunately, some of these students had procrastinated, and they had signed up for 2 or 3 activities this semester right before they're graduating, and all 3 of them might happen to have been community-based or clinical-based, such that all 3 were canceled. So we created 3 different messaging protocols for mass distribution, which I'll share with you in a moment, but we customized the messaging for the students and the faculty depending on how many activities they needed. We also needed to work with the registrar to get a graduation report, because some of our professions, we can't always assume when they're going to graduate. For example, graduate nursing, they're kind of on their own timeline, and oftentimes they may delay a semester or 2 depending on their personal circumstances. So we needed to confirm our students that were actually graduating. And then just focus on the students in true need of the requirement, meaning graduation, are going to start rotations. And then developing these templated communications to all our stakeholders, just so that they were reassured right away that we were on top of it. And also just to diminish the deluge of emails that our program managers were going to get as soon as the university announced that Project Homeless Connect and other activities were canceled. By being proactive and sending out the emails first, that really dampened the amount of emails that came back to us. Next slide, please. So as I mentioned previously, the categories of activities that we had to put on hold included clinical, community engagement, and live simulation. Recorded simulation still continued, and our case studies could have been reformatted for online. Didactic continued, and many of our health humanities activities could continue as well. So we had some other options for those students that needed more than one activity. Next slide. So how we did it. First, we canceled activities that had to be postponed, and that was really a team approach, because not only did the students that had individually registered for those activities had to be unregistered, but we had to work with our community partners to let them know that the university was canceling these activities. We had to unpublish them on our IPE passport site in our learning management system, and then looking at maintaining activities that could be online. So we reached out to the existing activities that were online and contacted those faculty moderators to query about the possibility of additional slots. Like, would they be open to allowing other students, other professions in, so that we would have more of a backup plan for students that needed more than one activity. And we also looked at innovative ways to solve some other problems that came up. For example, one of my activities uses standardized patients, and these are generally lay population, actors that are generally retired, and they come to campus and they come to our simulation lab, and they are each given a computer, and they get online and they do the simulation via Zoom. Well, they were no longer coming to campus because campus is going to close down, but most of them have not been trained, or they don't have the resources at home to do Zoom. So I needed an army of standardized patient actors. And so what we did was, in addition to using faculty that now have more flexibility because classes are online, we pulled students that were taken off rotation. So many of our professions, as you all may know, pulled their students out of their clinicals at hospitals and community clinics, but they still needed clinical hours. So many of them can serve the role as our standardized patients, and it's killing 2 birds with 1 stone, because they are getting some clinical credit for helping us out with our activities as well. We, of course, informed students on a very close deadline that they needed to complete their activities in the summer and fall, and we told them what the game plan was and when their makeup activities would be scheduled, and really just focused our efforts on those in need. And again, those are graduating students and students starting rotations. Next slide. So practical steps for structure. Again, we chose from activities that work in an online environment, whether that be a case study that is administered via a video case, so a recording of a scenario or a recording of a simulation lab, or a paper case. We also use simulations, so videos of standardized patients or synchronous online interaction with standardized patients, and then health humanities, so book studies and asynchronous online discussion as well. And I just want to caution, if using real patients, because this has come up, I'm in a hospital setting and I have students that are still on rotation, and just be careful to make sure, if you're using Zoom, you have the HIPAA compliant version if you're going to be discussing real patients online. Next slide. So these next few slides are just simply the communication that we sent out, just to give you some ideas for templates. But the first communication that went out was to our Passport facilitators. So these are the faculty that are running the activities. And we basically told them, in response to the decision to move to online only, we were working on a contingency plan. We had to cancel the activity, but you will be receiving a separate email if your activity was canceled, and let them know, reassure them we're monitoring the situation. And for students needing a requirement, we are contacting them to complete our healthcare providers, who are we, AKA the last ditch effort activity, on April 30th. And it will be online and synchronous. Students have to sign up. And then for others not needing it, stay tuned. We'll have more activities to come. Next slide. And this next one was the communication to students number 1. So these are students with less than 3 activities, telling them what their requirements are. And I'm not going to read it to you, but it was basically providing them with pertinent information. And the next slide is the communication to students number 2, which was to all other students that didn't urgently need a passport activity. I think I'm going to hand it back to Joy.
Thanks, Katie. So some of the challenges that we face and you face during this time are that decisions are changing rapidly, and then we needed to be, as a team, flexible and adaptable. For example, in 1 week, we went from being required to report to work to working from home, and all the buildings closed. And so at first we thought some of the activities might be able to still run, and we had to make some quick decisions about that. We were pretty proactive in realizing that we should probably move to all online. We saw kind of the writing on the wall. And we did really quick decision making and trying to make the best decision for all of our stakeholders. Our focus was really on communication and refocusing to ease anxiety of what people would need for the passport and their IPE requirements, both for our faculty facilitators and for our students. And we did have some back and forth with some facilitators that wanted to continue, and until the university made a final plan that we wouldn't be able to, we were trying to work with them on a one-on-one basis. So we did the best we could in those scenarios, but eventually most of those had to be postponed. And then we were advised that we should be careful about asynchronous activity, because if Zoom wasn't working well, what would we do as a makeup? So then we met again and said, let's have a backup to the backup. So we are recording that activity, and we'll build an asynchronous discussion that we won't publish online. So if somebody's internet fails or they're unable to attend, there will be an option for them to meet their requirement. And then we had to prepare and implement a normally co-located team to work divided and remotely. So we're doing daily check-ins. Team members send reports about what they're working on with each other. We're still having all of our regular meetings and focusing on that. And there's a lot of discussion. And I think there's going to be a webinar by the great folks at Arizona State on how you do that effectively. But that's essentially a new normal that we're all not used to, when we can bop in and ask each other questions and problem solve. So thinking not only about the students, but also our own team and what we needed to do to make sure we were successful. So we created a reporting document that all team members submit at the end of each day, demonstrating what they've accomplished. And that's been helpful to make sure we're still communicating and staying connected. Next slide, please. So reflections on our success. I mean, it really, and compared to what in my, for example, occupational therapy department, the level of stress and overwhelmness really wasn't as bad, because we got together and were really flexible and innovative. We knew that we had to prepare for the unknown from the beginning. And so we had done that, and that allowed us to be flexible. We also understand and treasure that IPE is not in one format. And our diversity, which is why we started this, showing that we've intentionally developed diverse activities to give our students a broad and comprehensive curriculum, but that also allowed us to be flexible in this time of unknown. And then another key success for us is that we have an assigned instructional designer for interprofessional education. And he's given us a lot of advice along the way about what we should and shouldn't do as far as moving the activities forward and which ones are successful. And that he was the one that told us you need a backup to your backup plan. We had not thought about that. And so that's a very important person at your organization to consult to make sure if you're moving to an online environment that you can do it and be successful. We also understand that we have respect for the unknown. Even this morning, the team and I were discussing our contingency plan, as I mentioned, for summer if we're not back and what that looks like. And we recognize that we don't have all the answers. So, you know, we're going to learn a lot, and we already have, about what we're implementing. And we hope to be able to collaborate with you to hopefully learn even more. Next slide, please. And then we are really preparing for the future. As I mentioned, our activities, we were talking this morning about, we do a really interesting occupational therapy and dental collaboration, and how could we move that to online and synchronous. And we're exploring innovations in our simulation delivery. Some of our simulations are still occurring with the students, and the faculty are filming it. So we're trying to make sure we're getting all those in good quality so we can use them in the future. Looking at case videos, and then really looking at how we're going to develop some telehealth interprofessional. As I said, our clinic sites have been contacting us asking for guidance and assistance in making telehealth interprofessional. So it teaches us that some learning outcomes around that, or learning activities, will be important. Next slide, please. So our advice is to stay positive. It's really easy to struggle with all the things you can't do right now, and staying positive is important to support not only, you know, your team, but the learners. We focus on what we could control and what we could do, which is funnel students to certain activities, looking at the resources that we did have to be successful. And as we mentioned, planning a backup to the backup. We didn't think doing a synchronous activity might be problematic, but there were concerns that Zoom would be overwhelmed and we needed a backup plan. Flexibility, and then being okay if it doesn't work out. Failure, we learn a lot in failure, and so how do we do our best and then reflect upon it and then do better for the next time. Next slide, please. Some more advice is really using your core documents. The National Center is a great resource for you. They have so many resources on their website. The Health Professions Accreditations Collaborative Guidance on Interprofessional Education document provides great definitions and resources for you on how to design interprofessional activities online. And so those are great resources to fall upon to look for experts that are doing it and get advice for you to experiment what works in your context. Looking to healthcare to innovate. I mean, healthcare has to still keep going. And so we've gotten some great insights from people that are doing telehealth. We have a primary care physician on our team who's moved to delivering telehealth and is feeding us information about what's working well and what isn't. So that's helping us design curriculum and think about how we present our activities to prepare students for that potentially new normal. And being okay with it being different than you planned. We obviously we're hoping to offer, it was very hard last Friday to not have our Project Homeless Connect Omaha, where we serve 500 homeless and an interprofessional model. And so we acknowledge that as a team. I sent in, we did some communication about that and talked about, wow, it's strange not to do that, but recognizing that we still have a plan and we can still be successful in teaching our students is what we focus on. And I think in interprofessional teams, being flexible is the most important thing. And so remembering that you are the experts in demonstrating teamwork and understanding complexity. IPE is hard work. It's not clear. It's ambiguous. And so you already live in that sphere. So taking those same skills and moving it forward in this challenging time. And then really focusing on your learning objectives. And that's really where we started and where we wanted to bring you. How do we define interprofessional? What does it look like for us? And your delivery can follow that. Because really the goal is to make sure that the students are benefiting and learning how to be good team members. The delivery model is important and it should be of quality, but making sure they're learning is really the key objective. Next slide, please. there was been some really, there was an interesting article that just came out that I wanted to share of use of telehealth experiences in the American Journal of Health System Pharmacy. That was a good article. And then there also is this great literature review on distance education and interprofessional. So there are some sources out there for you to look at. Again, check your HPAC, your guidance document, and the National Center, because they have great resources as well. Next slide, please. All right, so I think we really wanted to open it up also for discussion and encourage you to email us at cyper@creighton.edu. We'd be happy to dialogue with you, even outside of this webinar, to support you and share kind of what we've done. And I think now Katie and I are open to taking questions and having some discussion.
So thank you, Joy and Katie. One of the things I want to remind you is this webinar today is a big picture webinar. How did a center handle relatively very quickly transitioning from normal operations to online? On Wednesday, there will be a second webinar by the Creighton team, which will talk a little bit more about the nitty gritty. For example, how important debriefing and reflection is, and that type of teaching methodologies. So hopefully you can join us also for the second one. So Joy, we have two questions. And one is, are all of your activities pass-fail, or is there a requirement?
Yes, that's a great question. And actually that came up because our institution is making most of the classes, I guess, in the curriculums this semester pass-fail. And so we were actually grateful because that's already our situation. So our IPE 500 course is satisfactory, unsatisfactory. Our IPE 001 is the same. So they have to do 3 activities to pass. Obviously they can do more. If not, they cannot proceed. So that's a great question. And that's actually been really good for us because the university just made the recommendation that at least this semester, all activities move to that format. So luckily we don't have to adjust anything because we're already that way, which is, again, not something I would have thought about would have been important, but something to think about for the future.
Okay. We have a second question that is, in the virtual sessions, how do you assess the fulfillment of the IPE goals? How do you ensure an adequate level of engagement by students when the activity attains a lower level of fidelity?
So that's a great question. I'll answer and then pass off to Katie, because a little bit it depends on the actual activity and what the requirement is. So in our passport rubric, the faculty have to identify how the students will engage, and it has to be from, with, and about. So that has to really meet that definition, and that has to be defined clearly. So some of them have very specific requirements on that, and we could share some examples. And again, I think Katie and Mandy's webinar will go into that. Katie, do you have anything to add to that?
No, I mean, the best way to ensure adequate engagement is to limit the size of your teams. In some of our embedded activities for pharmacy, where our accreditation requirements interaction with the prescriber, we have many Zoom room going on, and it's just the prescriber and the pharmacy student interacting. So they're the only other individuals there to interact. So the best way is to engage them by limiting the size of teams, but certainly during some of the reflection, or when in some of our activities, we have them debrief, like for our ethics cases, with an ethics specialist, and the ethics specialist can use the Socratic method via Zoom and ask query students that might be quieter, that are not engaging. And I think Joy posted on the Q&A on Zoom, but one of the assessment tools that we use is the CICE tool that we developed at Creighton, and she posted the link. So that's how we assess that.
Okay. We have another question. Thanks for this great information. I'm interested in details about how you have supported clinical faculty who are facing such distressing circumstances.
Yeah, so unfortunately, we haven't delved too much into that, but we have been working with the team. So we have a very focused interprofessional clinical learning environment, primary care site that we really focus intentionally on. And so I've been working with that clinic team as they transition to telehealth. And it's been very interesting because 4 weeks ago in the state of Nebraska, where we live, you couldn't get telehealth in some of these areas. And so nobody has done telehealth interprofessionally in our clinic, because specifically in Nebraska, if you weren't rural, you didn't actually qualify for telehealth. So things have changed very rapidly. So I've been funneling them information from CMS and doing some consulting as far as that. Our team at the clinic, they huddle twice a day, and I actually saw last week, because I'm home, I'm not allowed to go to the clinic right now according to our work regulations. So, but somebody posted how much the huddles have helped the clinic team to get together and reflect, and how they're doing them via social distancing. And so they've actually had to move where they do the huddle so that they have more space to be socially distant. But yeah, more questions about how we do that in telehealth. And my response to them has been, this is all new territory and we're going to need to work together. So what I'm hoping to do is that we can do some debriefs after they've attempted it. They started their first week of telehealth 2 weeks ago. And so our colleague Amy McGahey is keeping us informed. And then Katie, you have had some experience with doing rounding on Zoom, and it's been going well, right?
Yeah, well, we're using telephones right now, because I don't know if everyone at my hospital, but I practice in the inpatient setting in the cardiac ICU. And in an effort to protect our providers, we've stopped our interprofessional rounds where we meet in a conference room every morning, and we are calling in. And I still have 4 students on rotation with me at the hospital right now. So the students have to be strategically separated into their own offices down in the basement, but we all call in via phone. And so it's great that they've had this practice doing Zoom and teleconferencing prior, because now they're using some of these skills to deliver that information. So they're seeing it in telehealth in practice.
You will hear me as we wrap up this webinar talk about we're looking for ideas of new sessions. This is an excellent one, or information or resources that you might need. A person that says, always love to hear what you are doing. Thanks so much for sharing, so helpful. We have another question, and again, keep sending them to us. Do you have a hotspotting team? Are you having discussions about how to involve students and teams of students virtually in patient visits in the future?
We don't have a hotspotting team. That's a great question. We actually, the AAMC pulled all the medical students. So we have been on pause with the clinical, and we haven't wanted to place additional burden on our clinical sites. So as we think of our contingency plan for the summer, we're really going to focus on that. We were talking about that this morning. We had to find out when clinical sites will be back open. Can our students be attending some of the clinical activities that we can? So I think we don't know yet. We're proactively looking at that. And that's, again, why we have those categories, because it'll allow us to really look at which things can continue and make the most sense. But right now, most of those are activities that we have like that are on pause because we've been forced to not allow students in those environments. So I think I think what we're all talking about is we have an opportunity to reflect and be proactive, and what is the toolkit or the resource for telehealth, or what education should we be providing to our students to prep them for what happens when you get pulled out. I mean, Katie's suggestion about involving them in, being standardized patients is a good one, but certainly other ways to supplement. So I don't have an answer there yet, because we're not even able to do that right now. So I'm sorry, I don't have a specific one. Katie, do you have anything to add to that?
No, I do not.
Okay. We have another question, and keep sending your questions in. Do you discuss ethical issues in pandemic as part of your curriculum? This conversation may benefit from interprofessional support.
Yeah, so we have been talking a lot about the ethics around that, and ethics is a great shared topic. So we don't currently, but we were talking about what other materials do we need to develop to support our clinicians and our students. And really, I think where we're hearing the most need is the question that was earlier: how do you do interprofessional work telehealth wise? Because that's where we're seeing most of our care here look like. And I don't know where all of you live, but all elective and non-necessary services have stopped. So even a lot of our outpatient therapy and traditional care deliveries have really slowed down. And so people are being moved around. There's an occupational therapist that's working on the front lines, and now she's not providing OT, she's screening people when they come to the hospital. So a totally different outside of her role. So I think there's a huge opportunity to develop and consult with people that have been moving into different roles to help us design curriculum that will prep our students to go into clinical environments and be flexible, because that's what these kind of experiences require us to be, which inherently is an interprofessional skill, to be adaptable, to be flexible. So hopefully whatever ethical situation we're in, we can enact those good team skills and be able to adapt.
Yeah, Joy, I think we're going to have so much content when we all get through this. I know personally my rotation with the pharmacy students right now is supposed to be cardiology, and it's turned into a COVID rotation because I'm also happen to be the research pharmacist. So I'm discussing with the students daily, okay, we only have so much hydroxychloroquine, who are we going to give it to? And the remdesivir compassionate use just shut down except for pregnancy and children. And how do we consent children in pregnancy that are on the vent? There are a lot of ethical issues that I've never dealt with just in the last 2 weeks in my role as a pharmacist. So I think we're, making note of this as we experience this, because I think we're going to have a lot of content to infuse into our IPE curriculum when we get through this.
Okay. Any other questions?
I see someone in the webinar chat asked a question about, moving clinical to telehealth, and we've had good success with Zoom. That's what we've used. Our university has a system for that, and so I know for documentation, I know Katie, you guys use EHR Go a little bit. Do you want to speak about that tool?
Yeah, we use it for our pharmacy case studies only, but there are a lot of interprofessional cases built in there, but the students work them up, and you can always put your own cases in there as well. You can build your own. So there's a large repository of cases. And then there's tools in there for the students to work up and present and submit cases within that product as well. So, but I have not used it in an interprofessional setting yet.
And I think on the webinar on Wednesday, you and Mandy are really going to demo and show how you use Zoom and how they've used some of the tools, so that those questions will be demoed for you, examples on the next webinar. So make sure you tune in.
So Joy, as you noted, one of the questions that did come in from chat that you answered individually is about your structure. So they're asking, is all these people that you've described, this large group of faculty, is IPE their primary focus? And if not, how do you handle needing support from faculty members who are having to focus on other priorities? How do you coordinate their efforts? This is a common issue in IPE in general. You want to share with us how Creighton handles this?
Sure. So yeah, I was nodding my head and then I realized you can't see me on the webinar. So that was a great question. Someone asked really how we're structured a resource. So our staff are full-time. We have 3 program managers and an administrative assistant. So what we've worked really hard to is really elevate them as professional staff to support. And that's been incredibly helpful in this time of change, because they bring really great ideas and are really familiar with the activities. All of our faculty have essentially an administrative stipend to do IPE, so they all still have their regular duties, and IPE is one of the many things that they do. Obviously that has its challenges, but we have a really committed team that really works hard and came together and recognized that we need to do this, but everyone is dealing with a lot of other priorities right now and getting pulled in a lot of directions. So we have a weekly team meeting and we just really try to communicate with each other. So could we do more and do better if we had more allocated time? Yes, we continue to tell the university that, but no, all our faculty are part-time and are making this work on top of everything else. So that's where I think my advice is good team building is incredibly important, and you're making sure you support your champions. And one of the things that was really important for me is the part of the team is to make sure that we came up with as much contingency planning for the faculty as we could. So the staff and I worked as a smaller teamlet to identify all the activities and come up with some proposed solutions that we then brought to the broader faculty team so that they wouldn't be having to make all those decisions, and that we would have some options. So essentially we came up with a couple of plans and brought it to the team. And we're doing that for summer as well. So they've audited all the activities for summer. We're reaching out to those passport facilitators, and then we're coming up with contingency plans for every activity.
And I'd like to add when recruiting faculty, like for example, for our backup activity, there's a lot of power in recruiting them when you're saying, you know, we have these 40 students that need to graduate. They've got to complete this one activity. Can you help? Can you give 1 hour of your time? And for our pharmacy activity that we do with prescribers on Zoom, I tend to need about 12 to 15 faculty for the entire day. And there's a lot of power in the accreditation card with pharmacy. This is an accreditation mandated activity. Pharmacy students have to interact with prescribers. We need your help. And especially getting upper administration deans involved with that. I really don't have trouble getting the volunteers I need.
Any other questions?
I'll just add, Barbara, I'm happy to talk offline too to anybody that has questions about our structure. They can just reach out to us and we're happy to share that.
Sounds good. If I am not seeing any other questions either in the Q&A or the chat functions, I will wrap this webinar up. And first of all, I want to thank the two speakers who have joined us. Joy and Katie, you did a terrific job. Those of you who are on, although I see another chat coming in. Oh, very good, and thank you. So we have another webinar coming up on Tuesday or on Wednesday. Again, with the Creighton team, they'll be giving more tips about teaching and a little more going deeper into the process of teaching interprofessionally online. Next week, I will be giving a webinar with Laura Pesa, who is the National Center Evaluator. As we sit here in the national environment, watching everything that's going on, both in practice and education, we're going to give you some tips to document this massive change that's going on and suggest a tool to use so we can learn together, but also so that you can learn for your own program. Joy and Katie did a magnificent job really reflecting upon the massive changes in their program. We think that we all should be doing this and collecting these together to build a stronger IP in the future, both locally and nationally. Next week also, we will have the Arizona State University team that will be participating in another webinar talking about how do you build teamwork online. And again, we're looking for ideas and suggestions. What do you want to see these webinars and discussions hosting, and ideas that you have for speakers who can join us? And then finally, I'm going to do a promo to encourage you to join the American Interprofessional Health Collaborative. We'll send you a reminder how you can join, and we're here for leaders and scholars in interprofessional education. So thank you for joining us, and we'll see you hopefully on Wednesday. Bye-bye.